What autoimmune blistering disorder is associated with people over 60 years old? It involves the mucosa and is highly associated with dementia, Parkinson's, and depression. You should be thinking about bullous pemphigoid. You first have a phase where it's just pruritic or itchy, it's eczematous, and you can see lesions that last weeks to even months. This is called the prodromal phase. The next phase, you start making bullae, which rupture into erosions. It can either be in a diffuse pattern or it's very localized. It usually involves your trunk, your extremities, your armpits, and even the inguinal folds. Remember that this is commonly tested versus pemphis vulgaris. Bullous pemphigoid is pruritic and not painful and is accompanied with a rash. The diagnosis must be confirmed. You do this with skin biopsy. You can also do serology for antibodies against the antigens, which are the hemidesmosomes. Remember that the number one treatment for bullous pemphigoid is high-potency topical corticosteroids, like clobetasol. I remember this because bullous pemphigoid reminds me of the word bully, and to me, bullies take steroids. If you don't want to do topical therapy, you can also do systemic therapy where you can take oral doxycycline and an oral corticosteroid. Those taking step 1, remember that the histology shows subepidermal cleavages, and on immunofluorescence you'll see IgG C3 deposition along the basement membrane. Now there is a disease where you can have some autoimmune cutaneous eruptions because the patient had some gluten. I hope you're thinking about celiac disease causing dermatitis herpetiformis. The way you distinguish this from bullous pemphigoid is that there is no prodromal phase like I was talking about earlier. You treat dermatitis herpetiformis with dapsone and make sure of course you take gluten away from their diet. Now that we're in the topic of rashes, don't forget that anytime you see some sort of unilateral dermatomal distribution, alarms should be ringing in your head that they're talking about herpes zoster. You treat herpes zoster with oral valcyclovir.